On today's episode, we're going to be talking about Washington's universal health care push. Stay tuned. Welcome back to Behind the Wire. I am your host, Robert Burwell. I'm also the president of the Washington 3%. Today we're talking about Washington's new push for universal health care. This is all brand new. Getting this information from the conservative ladies of Washington State. They published this today. And what they are talking about is this legislation was just filed today. So you can't even find this on the state government website yet. So they got a hold of copies of these bills as they were filed. So even though you can't look at them on the state webpage, they did publish these today. And so I'm going to go over what they discovered today. Again, today is December 30th. 2025, and these bills were just filed today. So this is what we're looking at here. Olympia has introduced 4 coordinated bills that move Washington toward a state-run universal health care system. This is not random. This is a multi-year plan now entering its next phase. So the first bill that we're talking about is Senate Joint Resolution 8206, Constitutional Amendment. This bill is going to create a constitutional right to affordable health care for all residents. This would make universal health care a permanent state obligation. So they want to do a constitutional amendment to make universal health care a permanent state deal. And to amend the Washington State Constitution, it requires a 2/3 vote in either of the legislatures. So either a 2/3 vote in the Senate or a 2/3 vote in the House. Now, once it passes that 2/3 vote in either legislature, it then has to go before a vote of the people, where a simple majority will turn it into an amendment in the Washington State Constitution. So basically, though, they have filed under Senate Joint Resolution 8206 for a constitutional amendment to make universal health care a permanent state obligation. Okay, and we'll talk about that stuff a little bit later on here. The next thing they did was they filed Senate Bill 5946, Medicaid expansion. Again, these were all filed today. This 5946 is a bill number they use all the time, and they're constantly changing stuff on it and adding to it. And basically, they're going to add to Senate Bill 5946 a Medicaid expansion. This expands Apple Health eligibility to 300% of the federal poverty level. This moves a large portion of the middle class into publicly funded coverage. So, under the current Apple healthcare eligibility thing, which is the state-assisted healthcare that we have in Washington, it's only available to people who are at the federal poverty level. Well, they want to raise that limit to 300% of the federal poverty level. So I believe the federal poverty level right now in 2025, I looked it up earlier, it's $15,560 a month for a single person. Is $32,000 and some change for a family of 4. So they want to make it 300% of what the federal poverty level is. So that would be 3 times 15,000, that's, for a single person, they would claim they're at the poverty level if they're making $45,000 or less. For a family of 4, you would be at the poverty level. Geez, why is that so hard to say? You would be at the poverty level in Washington State if you're making $120,000. Well, actually, about $126,000 or below. That would qualify you as poverty level to receive health care, universal free health care from Washington State. Okay? So we're going to get into that a little bit later too, what that's going to do. Let's see. And how these work together. These bills create a constitutional mandate, Senate Joint Resolution 8206, a governing board, Senate Bill 5947, a timeline, a blueprint, Senate Bill 5948, and early coverage expansion, Senate Bill 5946. This is a coordinated roadmap towards a universal system. Those were out of order in their little slideshow. Let me go back. So, another bill they introduced today is Senate Bill 5948, Universal Care Deadlines. It requires Universal Health Care Commission to deliver full system design, financing plan, governing model, draft legislation, deadline December 1st, 2029. So this bill is going to mandate that the commission go in there to study and set up this universal health care system with a plan to set up this universal health care system, how it's going to work, everything, by December 1st of 2029. Now, you know how these little bills go with these fact-finding teams where they fly them all over the planet to look at other systems and all this and end up costing us billions of dollars, which, that's what they did for the airport that they wanted to build in a place they found out they can't build, right? That's why that failed. They wanted to build this new airport down here by Fort Lewis in their airspace, and these people flew around for 10 years. They spent like somewhere close to $1 billion on their fact-finding and studying of where they wanted to put the new airport. They came back and picked right next to Fort Lewis in their flight path, which they can't do. So that's the kind of geniuses we put on that. It took them 10 years to do that. It cost us a bunch of money, and it's all for nothing. They got to start over. But this is the same type of deal. A fact-finding commission that's going to set this whole thing up and cost us tons and tons and tons of money. It's not their money, though. It doesn't matter, right? And the last one, I believe this is the last one. Yeah. The last one is Senate Bill 5947, Washington Healthcare Board. This creates a new board to design and eventually run a statewide universal healthcare plan. This is the governing structure for a future state-run system. So, excuse me. Now, we're talking about all this universal healthcare stuff, the stuff they want to do to pass universal healthcare. And let me take a drink here. The reason this matters is this package would expand government-run coverage, going from just the people making less than $15,000 a year, getting free medical paid for by the state, which is already costing us billions every year. They want to expand that to anyone basically making less than $125,000 if you're a family of 4. Anyone making less than $45,000 if you're single. So it's going to put all these people. It's going to put a large chunk of not just the low-income people, a large chunk of the middle class is going to be able to get in on this too. Free health care, right? Totally free to them, which the rest of us are going to have to pay for in our taxes. Anyways, so it expands government-run coverage. It builds the infrastructure for a universal system, makes healthcare a constitutional right, and moves Washington toward a unified financing model, including single payer. This is the largest healthcare shift in state history. So, what all these things are going to do, if they get them through, again, we're going to make it a constitutional right to have health care. And then we're going to put half the people in the state on this plan, right? Half the people, because of their raising of the poverty level, half the people in the state will be on the plan. And the rest of us are going to get taxed for it. They still got to figure out how they're going to pay for all this. It's going to cost billions of dollars every year to run a system like that, covering everybody in the state, at least half the people in the state. We have a state of 8 million people. That's 4 million people are probably going to end up on free healthcare. And that's just a start. They want it to eventually be everybody. But number one, our state is already facing a budget deficit of $4.3 billion by between 2027 and 2029. Our state deficit is going to be $4.3 billion. We're already in the hole. $4.3 billion. Okay, and they're raising taxes to try to cover that. How much more are they going to have to raise the taxes to put this shit show in work? You know, this universal health care. How much more are taxes going to go up? We're already in debt, and this is going to cost billions and billions of dollars to do this universal health care for everybody. And it's, you know, we're already in trouble. Our state's already in trouble. If they don't turn things around, we're going to be bankrupt. And they just keep spending money that they don't have with these pipe dreams. And, you know, as far as universal health care is concerned, my personal opinion, anybody who thinks universal health care is a good idea, any health care run by the government is a good idea, you're out of your damn mind. They can't even run the post office. They can't even run the post office. You know, realistically, if you want to see what universal health care, government-run health care looks like, just go to the VA sometime. Go to the VA. See what that's like. VA is a disaster. Okay? You go to the VA and you got something wrong, right? You got something wrong with your neck, right? And you go in and you say, hey, I need a referral to go see a specialist. Because you can't just go see a specialist. You have to go to the VA and then you have to get a referral from a doctor to see a specialist. Then it goes to some bureaucrat's desk in the VA and sits there for months and months and months. And all they have to do, their whole job, is to look at it and say, doctor says they need it. Okay, authorized. Here's your referral. Go see a specialist. On average, that's taking between 6 and 9 months to get a referral out of the VA right now. And I know that from personal experience. 6 to 9 stinking months to get a referral. I've seen some that take a year and a half. And it's like, what's going on with this referral? You know, if it was something bad, I'd be dead. That's government-run healthcare at its finest. You want more examples of what government-run healthcare is like? I got a really good one. I had an employee when I was a manager at Boeing. Had an employee. He had dual citizenship, which means his father was American, his mother was English. Okay? He had uncles on both sides of the family. One in England, universal healthcare. One in the United States, where he's private healthcare. Okay? Within a month or so of each other, they both found out they had heart problems and they had to have bypasses. Now, this is his story, not mine. And he's on the English side. He was all for universal healthcare. But this is the story he told me. They both had to have bypasses. The uncle in England needed a bypass. He got put on a list. Next available surgery. The uncle in the United States, doctor says, you need a bypass. Surgery's tomorrow. Uncle in the United States had surgery the next day. He's still alive. Uncle in England made it 7 months, still hadn't had the surgery, and died because he never had the bypass. And there's stories like this from Canada, any country that has universal health care. This is what you hear. If you need anything, you get put on a waiting list and hope you live long enough to get it fixed. Yes, our medical system isn't perfect, but you know what? If there's something wrong, you can go in and get it taken care of. Okay? And if you don't have the money, you still can go in and get it taken care of. Even though you have no money, you still can. You just can't have elective stuff done. But stuff that's going to save your life, they will do it. And a lot of times they'll forgive the debt, or charities will help pay for it, or whatever. But you're not going to die on a waiting list in our current healthcare system. Unless you're at the VA. Because I've known people who've died on waiting lists at the VA for healthcare. Which is, again, universal socialized medicine. But that's what you got to look forward to. But anyways, this just came out today. You can't even look these bills up on the internet because they're not on there yet. I just saw it today, so I thought I'd put it out there right now. Oppose this stuff. The one thing I'm hopeful for is that they can't get a 2/3 vote in either of the houses. And if they do manage that, I'm really hopeful that the voters in the state are smart enough not to vote for that constitutional amendment if it goes through. But again, that's all the information we have on it right now, just what was put out from the information that was received by the conservative ladies of Washington. And I'd like to thank them for publishing that so the rest of us could see it and we can get the word out there to more people. And all that, that's all I got for this episode. It's kind of impromptu. I do not have a prepping thing ready to talk about, but I will say that if you want to know more about us, go to 3%.org. That's WA number 3%.org. And you can also check out our charity, which is Boots on the Home Ground, for veterans and communities in Washington State in need. That's all I have for today. See you next time on Behind the Wire. Good night.